Looking at the common injuries around the shoulder, elbow, wrist and hand, we can start with fractures to the clavicle, humerus, radius and ulnar, and the carpals, metacarpals and phalanges. Joint problems can be observed, starting with subluxation of the sternoclavicular joint and leading out to the end of the clavicle, subluxation of the more commonly injured acromioclavicular joint, especially from contact sports. The main glenohumeral joint, due to its mobility and vulnerability in contact sports, can be dislocated with the head of the humerus being forced anteriorly or posteriorly out of its shallow socket. Looking at injuries to the controlling musculature, the common problems are found with the rotator cuff muscles. At the front we have subscapularis, in the middle supraspinatus, and posteriorly infraspinatus and teres minor, which is rarely injured. However, the first three, along with the subacromial bursa, can be pinched or impinged between the head of the humerus and the acromion process. And when the patient has a painful arc on abduction, this indicates inflammation, hence the term Impingement Syndrome. If we follow the arm down, at the front, we find the biceps muscle, often irritated as its long tendon passes through the bicipital groove, and there are general muscular strains to triceps and biceps. Moving down into the elbow and forearm, we can get problems with the common extensors, which are the muscles that extend the wrist and are generally irritated at their origin, commonly known as tennis elbow. On turning the arm over, we can get problems with the common flexors, again due to excess tension at their origin, generally known as golfer's or thrower's elbow. The wrist itself, other than fractures, can be strained or sprained, and if overused, for example excessive typing, racket work, throwing activities, can suffer with tendinitis, sometimes known as repetitive strain injury. Coming onto the inside of the elbow, we have the ulnar nerve that supplies the little and ring fingers. Compression or damage to this area will cause numbness or tingling into those fingers. Hitting your funny bone demonstrates this feeling. The other nerve that comes down the centre, supplying the outer three fingers, is the median nerve, and if this is compressed, the condition called carpal tunnel syndrome may be suspected. The way to check this is Phelan's test, where the wrist is held in full flexion for 30 seconds. If numbness occurs in the thumb and inner two fingers, the median nerve is affected, and if numbness is in the ring and little finger, the ulnar nerve has been compressed. Other problems in the hand can be fractures to the fingers, ligament and tendon injuries, especially if the thumb is pulled back, for example skier's thumb. And if the distal finger tendons are avulsed, a condition called Mallet Finger may be present.